Hey everyone, it's Samantha Jamerson. Welcome back to my channel. Today we are talking everything that has to do with lip filler.
Invited, left home in West LA, I'm not excited. So uninspired, on my way to play the bay while you're alone. This girl's a wonder, she loves me, yeah, she needs to know I love her. I wonder if we'll make it through this summer. Just wanna touch like back when we were younger. Yeah. Why don't you love me, love me, love me? Touch me, touch me, touch me more.
I am so excited because lip filler is probably one of my most favorite cosmetic procedures to perform on my patients and myself. So if you kind of want to learn all the ins and outs, all the information, if you were debating getting lip filler done, please continue watching because you will learn a lot in this video.
Touch me, touch me, touch me. I'm so divided, starstruck, but haters got some indecisive.
So what is lip filler? Lip filler is a non-invasive cosmetic procedure done in the office that can enhance, hydrate, and define your lips. It's something that has been done for years and it has become extremely popular due to a very famous person known as Kylie Jenner. I truly believe she was the one who kind of normalized lip filler, if you will. Lip filler has been around forever, but I felt like she kind of made it more popular, especially with my young patients. Because of that, it truly is the most common procedure I perform in the office, which I love because I absolutely love doing lip filler. It's such an immediate gratification for myself and for my patients, so it is one of my favorite things to do, and I am very good at it, so I'm excited to kind of go through with you all the ins and outs so that if you are thinking about getting lip filler done, or maybe you have an appointment scheduled, you can kind of be best prepared and know what to expect afterwards. So what's in lip filler? Well, lip filler, the two products that I mainly use are Juvederm and Restylane. Both of those are a hyaluronic acid filler that contain lidocaine. So hyaluronic acid is something that we naturally make in our bodies, but over time it starts to deplete. And one area is our lips. We lose volume, we lose hydration, which hyaluronic acid can help bring back. And then there's lidocaine in it, which makes it a little bit more comfortable and tolerable during your procedure. I personally put topical numbing on you before I even begin injecting, but as I'm injecting, you'll start to get even more numb because of the lidocaine in the filler itself. So I love both products for the lips, Juvederm and Restylane. I've used them both on myself and as well as my patients. But if I had to pick, I am a little bit more of a Juvederm lover for lips. I just feel like it's a little bit more plump and natural. Restylane, I just find it can hold the structure of the lips, which some people are after, but I just find Juvederm to be softer and more natural, but still giving you that volume that you desire. The amount of time that it actually takes to inject the filler into my patients is probably only about 15 minutes, but I always prepare my patients to be at my office for about 45 minutes. And that's because I just like to take my time. Lip filler, or any filler for that matter, is truly an art form. Anyone who is properly trained and has, a medical degree, whether it's physician, PA, nurse practitioner, can get trained to do filler. That doesn't mean that you're going to be great at it. And I truly take so much pride in my work. And I tell my patients all the time that when I start doing your filler, whether it's your lips, your cheeks, whatever, your face becomes my face and that's my name on your face. So I want to make sure that your results are fantastic and not just average. And my purpose is not to get you in and out as quickly as I can so I can see more patients. Like, of course, I want to be busy and I want to see as many people as I can, but I want to make sure I also have the time to take my time and give you my best work. The reason that you're there for probably about 45 minutes is because you show up to the office, you check in, one of my medical assistants brings you back into the room. I come in and talk to you, I look at your lips, I take a bunch of pictures, we look at the pictures together and we see, are you asymmetric? Are you just lacking volume? Are you more full on one side than the other. You know, I look at the whole picture. I look at you in person, I look at you as you're talking, as you're smiling, and I look at the pictures. Then I step out, my medical assistant comes in, then she cleans your face and your lips, making sure that we remove any makeup, lip gloss, lipstick, and then we put topical numbing on you. Our topical numbing that we have in the Center City office contains 3 different types of numbing agents: lidocaine, tetracaine, and benzocaine. These 3 agents are amazing together. When I do my own lips, when I inject them, I'll put the topical numbing on, and I swear within 15-20 minutes, like my entire lips are completely numb, which is great because then it makes injecting them more tolerable. There are some injectors who believe that the topical numbing agent is not necessary, and it may actually make you a little bit swollen prior to injecting. I can see that. I definitely have some patients who always say that after I wipe off their numbing, they feel like their lips are fuller already. But for me, I don't find that it obscures my view that much that I can't see what's truly swelling and what's not. And I think part of the process is making the patient feel as comfortable as possible. And I know some injectors who don't topically numb, and these patients tell me how awful it is and how excruciating the pain is. So I truly find that with the topical product, the numbing agent, that my patients say it's far more tolerable. So topical numbing is on, my assistant leaves. We let you topically numb for about 10 minutes. So I come back into the room 10 or 15 minutes later, I clean you up, and then I start injecting. And as I'm injecting, I don't just inject your entire lips and then I walk out the door and I leave. Like, I'll inject one side of your upper lip, I'll sit you up and I'll look at you and I'll see how it's looking. Are we looking symmetrical? Was the side that I just injected less fuller than the other side? And now are they even? Like, I like to sit you up and look at you from all angles. Then I lay you back down, go to the next side, sit you back up, look at you again, lay you down. You know, I laugh that my patients get like a workout with crunches because I move them up and down so much, but I just want to make sure that you are symmetrical and full and even from every single angle. So then when I'm done, I take a bunch of pictures myself. I'm crazy with before and after pictures because they are so important to showcase my work and to get my name out there and to get people to want to come in and see me. So my assistants probably hate me sometimes because I'm like, can you get more photos? This lighting was different, the lighting needs to be the same. Like, I try my best to make the pictures as accurate as possible so that no one can say like, oh, it only looks that way because the lighting was off or it was a different angle. People are haters, let's be honest. So then afterwards, then I finally give the patient the mirror and I'll put their before and after pictures side by side for them to see. I will sometimes not inject the entire syringe on the first visit, and I'll tell you why. I like to save like just a little bit, maybe like 0.2, 0.3, and that's because it is inevitable that swelling is going to occur. And that's not because of the filler itself, it's because of the needles. Anytime you pierce the needle through the lip, which there are a bunch of needles that occur when you get lip filler done, it's gonna cause swelling. And what I absolutely hate is, and I've done this in the past if I'm being completely honest with you guys, I've injected the full syringe because when I look at them, they look completely symmetrical, they look even, and I think that they're good. I think that, some people do want more after the one syringe, but I think in terms of symmetry, they look great. I have in the past had patients reach out to me like, hey Samantha, like I do feel like my one side's a little bit uneven. It's not like extremely noticeable, but because it's my face and it's my lips and I look at myself every day, I notice it. Well, then they have to buy another syringe in order to fix that. And usually it works out in my favor because patients fall in love with the swelling phase that they end up wanting more filler anyway. So I just kind of used another syringe to fix any asymmetry and then add more volume. But if they don't want more volume and they have asymmetry, like I personally feel guilty that they have to buy another syringe because they have asymmetry that possibly I should have been able to fix the first time. So I always like to save like 0.2, 0.1 or 0.2, honestly, because I know that doesn't sound like a lot, but it is to fix asymmetry so that they can come back in 2 weeks, 2 to 3 weeks, when their lips are completely healed, and then we can look in the mirror together and see if there is any asymmetry that we need to target. And now we have some of their own product left of the syringe that they purchased 2 weeks ago, so they don't have to feel like they have to purchase another syringe to fix minor asymmetry that maybe only needs 0.1 or 0.2 to fix. So now that you kind of know what entails in terms of like the injection process, let's talk about what to not do prior to lip injections. You should not drink alcohol. You should not take any blood thinners like ibuprofen, Motrin, Advil. You should not drink caffeine 24 hours prior to injections. This is all because all of these things will thin your blood, which will make it more likely for you to bleed and therefore bruise. I cannot even begin to tell you the women who forget about that simple rule. I literally had one woman one time that was injecting her lips, and like every single time I came out with my needle, I would inject her lips, come out to go to the next area, and she would just bleed, and I would have to hold pressure, and she was starting to swell like crazy. And I was like, what did you do last night? Just like curious what she was gonna say. And she's like, oh, well, last night I went out with my girlfriends. You know, we had I don't even know, maybe we split 2 bottles of wine between the 4 of us. So I needed a really big coffee this morning to get my day going, blah, blah. And I looked at her and I'm like, okay, so we are only going to use about a half of your syringe today. I'm gonna send you home and you're gonna come back in 2 weeks and we'll revisit when you don't have all that blood thinning properties in your system, because she was starting to swell like crazy. And if I kept injecting, she was gonna be uneven no matter what. So I was like, you know what? Come back in 2 weeks. Do not do any of those things that you did in the past 24 to 48 hours, and we'll regroup and then we'll inject the rest of the syringe. So sometimes you do have to tell patients that. Like, I have patients who do everything right sometimes and they still get significant swelling. Some people are just more prone to it. And that's where, as the injector, you have to be able to step back and be like, okay, you're really starting to swell. I don't want to keep adding, because then you're looking at the person like, that side looks fuller, but it shouldn't be, except with the exact same amount. So is that swelling? Is it not swelling? And then if you add to the other side, well, when that swelling goes down, then this side will be uneven. So as the injector, I think it's smart to bring them back in a couple of weeks so that you can not do too much at once, because you never want to do too much and then them be unhappy. You rather say, hey, we're probably gonna have to add this last little bit in like 2 weeks. So let's do this today. Let's let you heal. And then in 2 weeks, we can add the rest. And the majority of the time, they're okay with that. Other important things that you should ask prior to doing lip injections is their medical history. You want to make sure for females that they are not pregnant or currently breastfeeding, because there have been no studies to show that filler is safe during those 2 times. You want to make sure that they don't have any autoimmune conditions, any history of cold sores. Cold sores is important because not that filler itself can cause a cold sore, but we know that cold sores, which is herpes simplex, can occur due to trauma, due to stress, sunlight exposure. So if you think about it, it's not the filler itself, it's the needle piercing your lip every single time. That's trauma to your lips technically. So you would want to know if someone was prone to cold sores, because what I personally do is treat them prophylactically, meaning if they were coming in for lip filler, let's say on a Monday, I would have them start to take valcyclovir, also called Valtrex, which is a type of antiviral medicine that we prescribe for patients who get cold sores. I would have them start taking it 3 days prior and then 4 days after injection to hopefully prevent a cold sore from occurring. Now let's talk about what to do after lip injections. So the biggest thing with lip injections is you want to prevent bruising and swelling. So one of the best ways to prevent swelling is ice, ice, ice. It is so important if you want to reduce the amount of swelling you get after lip injections. I recommend to my patients 20 minutes on, 20 minutes off, 20 minutes on. And if you can do that the first night and then the next morning, that will significantly reduce the amount of swelling you have. Another thing that you can do is take a Benadryl at night. Antihistamines are known to be beneficial in preventing significant swelling, and also sleeping with a couple pillows propped up. Like if you can sleep on your back with a couple pillows propped up so your head is elevated, that can help out with swelling as well. Another thing that I'll sometimes do is I will prescribe prednisone for my patients. Pre-COVID, I always told my patients that like if they have a big event coming up or a wedding or something that they don't want people knowing they have lip filler done, you would not want to get lip filler the day before one of those events, because swelling happens and is most significant 24 to 72 hours post lip injections. So some people, like maybe they don't have an event that soon, but they have an event within the week and they really don't want anyone knowing they had lip filler done. So I'll prescribe prednisone, which is an oral steroid, which will also significantly reduce swelling. Now, thanks to COVID, if you will, my patients don't care because they have the mask. So in their mind, they're like, well, I have time to heal and no one's gonna see it because I have the mask, or they're working from home. So a lot of patients don't require the prednisone or don't really wanna take it. So COVID actually works in my favor for that, because patients are claiming that they have time to heal without anyone knowing they had anything done. Back to that, pre-COVID, I always recommend to come in and get lip filler done when you know you don't have an event for like 1 to 2 weeks, because swelling can technically take 2 to 3 weeks to fully go down. Most of my patients say by day like 3 or 4, they're fine. And they actually love their lips more day 2 or 3 when there was a little bit of swelling. But in theory, you want to plan it around when you have some downtime. So in terms of how frequently you should get lip filler done, rule of thumb I tell my patients is lip filler can last up to a year. But like I put a little asterisk by that because everyone is different. Some people feel that in a year, their lip filler is gone and they want more, so we can do another full syringe. Or if it lasts for up to a year, it's safe to say that then half of it's gone in 6 months. So some of my patients come in every 6 months for a half a syringe just to maintain. However, then I have patients who have been to other offices who come into me like for a correction or to continue injecting their lips. And I'm looking at their lips and I'm like, I need to dissolve this in order to, give you the results you're looking for. And they're like, no, I had lip filler done like 3 years ago. There's no way it's still in there. And I'll like show them the mirror and I'm like, no, it is. So everyone holds on to lip filler differently, and some people do break it down quicker than others. But rule of thumb is if lip filler can last up to a year. So that's about it. Lip filler is my favorite cosmetic procedure to perform, if you can't tell. So if you are in the Philadelphia, South Jersey, New York area and you want to come see me for lip filler, I promise you won't be disappointed. And even if you're going to another injector, there are other amazing injectors out there. So I just hope this video helps you understand lip filler and the process of lip filler and kind of what to expect, what not to do prior, what to do after. I hope you learned something. And if you have any more questions about this topic or you want me to discuss other topics, please comment below and let me know. Otherwise, I'll see you guys soon.